And nothing is as powerful as your health. Your first asset, your main wealth, is your health. Here is the long-awaited conversation that you have been waiting for today, the 24th of March, on Matters Health. This is Healthy Inside Out, and you are still watching hashtag The Morning Drift. Thank you very much for trusting us with information and, of course, our solution-focused conversations. I am joined today, this morning, by a very credible doctor here on set. She is Dr. Wanjiru Karimi, who is a consultant urologist, and she will, of course, let me understand how to pronounce this particular condition properly. You know, sometimes medics can help us understand these matters, and that is hematuria. I hope I pronounced it correctly. How are you today?
Morning, Anke. How are you?
Good morning. I am fantastic. I'm ready to learn. And so are the viewers back at home. But first, maybe they need to hear your opening remarks into this segment with the camera right there.
Okay, fantastic. So my name is Dr. Wanjiru Karimi. I'm a consultant urologist. Actually, we are 3 in the country, so I'm amongst the 3. Well, when it comes to urology, we deal with everything urinary system, from the kidney, the bladder, the ureter, and for male patients, we have the prostate, and for children, we also have what we call testicular torsion. Today, what we had in mind is a topic by the name hematuria. You actually pronounced it very well.
Thank you.
Yeah, so hematuria, I think I can just dig in right in.
Yes, you can. And of course, as you dig in right in, remember that whatever she gives is a presentation, very brief, but you can always ask your questions and we can ask them as we continue. So once she starts digging in, still feel free. We are live on Facebook to now actually answer the questions and concerns around hematuria. But please take it away, Doc.
Okay, sure. So I'll start by the definition of hematuria. Hematuria is blood in urine, which is not normal in any day or in any presentation. So there are 2 types of hematuria. Hematuria can either be microscopic, and that's when you have routinely gone to the hospital and they did a urine test, they looked at it, and they saw red blood cells, which is what gives the pigmentation, And it can also be macroscopic. Macroscopic is when you're going to the washroom, you're passing urine, and your urine is blood-stained. However small, however little, it's usually a really great concern for us doctors. So I chose to discuss hematuria today with Anke because it is one of the symptoms that we really should not overlook as medics, and also as a general population. Especially in women, where whenever we see urine in blood, we assume that it could be a urinary tract infection. So we have lost quite a number of patients and on follow-up because they have been managed as urinary tract infections. And truth be told, it's not a urinary tract infection only. There are different causes of hematuria. So one of the causes is, as I've mentioned, a urinary tract infection. It could either be bacterial, which is the most common. It could be viral. It could also be fungal. So when you have hematuria, there are other signs and symptoms that we would also be looking out for. Is there pain while you're passing urine? Do you have a fever? And even for women, could you be on your menstrual cycle? And therefore, maybe when you're collecting your urine sample, it's actually mixed with your menstrual, your menses, So that is the one thing that could cause hematuria. Another thing that could also cause hematuria really is when we take some specific drugs.
All right.
Like we have anti-TB medication. They can actually... And
today is TB Day.
Oh, yes. So for all the people who are battling with TB and who are on TB medication, really, if you were to see your urine hue is red in color, you can first rule out a UTI and any other cause, and when you're in the clear, we can now assume that it's actually the drug-induced hue in the urine. Another reason which would cause hematuria, which could also be quite common, is when you have a stone, or what we call a urinary calculi. Today is your word to learn new words. So a urinary stone can be anywhere. It could be in the kidney. We celebrated World Kidney Day just the other week. So it could be in the kidney, it could be along the kidney pathway, which is now called the ureter. It could also be in your bladder or on your way out. So in these patients who have hematuria and they have a stone, for sure they will present with a fever.
All right.
If it is obstructive. If it's not, it will just be a painful hematuria. Yeah? Those are safe people, really. It's a stone, we can deal with the stone. Now, the hematuria that really scares us is the one that is painless. You do not have pain, but you're passing blood-stained urine.
Yes.
Why would I say it worries us, Anke? It's because it could be a sign that you might be having a tumor, either in your kidney and in your bladder. So really, these are the people that we are trying to get to understand that when you have blood, it is not normal. Yes. We do see a lot of renal cancer patients who have been lost to follow-up. Sometimes it all starts with just that, the blood in urine. It can also be an abdominal mass, so you just see someone is adding weight, and really it's not just normal weight or girth, it's one-sided, and you can actually palpate the kidney. The good thing about renal cancers is that most of them can be treated surgically. It's only when it has advanced, and that's why we treat first surgically, and then now we have chemotherapy. Yeah? The other part where we have hematuria, which usually worries us, especially because this is Kenya, it's in bladder cancer.
Yes.
So there are other risk factors that we look at. When you come to us and you have blood in your urine, what are we asking you? Do you smoke? Do you work in a factory? Do you grow rice, like the patients who come from where? Because then they have an infection called schistosoma, which is a worm that is a risk factor for someone to get hematuria. Yeah? So all these are people who have hematuria and in the background of bladder cancer. Then finally, another cause of hematuria could when we be having a benign bladder enlargement, what we'll call BPE. It's common in men in Kenya over 50 years, really, unless you have like positive family history, your brother, your father, in which it can start even earlier. Yeah. So when you have an enlarged prostate, it is so huge that it blocks the pathway, which is called the urethra, and therefore, when you're passing urine, the prostate bleeds out, and the blood now gets mixed with your urine. So really, when a patient presents to us or to a medical facility, these are all the causes that could be causing hematuria.
And like we said, these are signs and symptoms you cannot afford to ignore. And when you hear Doc speaking here, this is actually justified. You cannot ignore. And I wanted to hear from Doc. Like you said, the Kenyans have a tendency of, until it gets to the last stages, then I will seek, medical attention. As now we have you here, and there's only 3 of you, so they're very lucky to watch this morning to get this information free of charge. How soon? Should I, get to the hospital or reach a doctor, which is the first symptom that could be telling me, you know what, this is not what you think it is. When should I get that medical attention? Okay. Yes.
So when you have hematuria, the most basic way to rule out what your cause of hematuria would be because you have a urinary tract infection. And how would we confirm that? There are 2 tests. We do a urine analysis, where you just pass your urine, pee, in a bottle, and it's taken to the lab. The results should be out in around 30-40 minutes. Yeah, pretty fast, you know. And it's available. Even in the most expensive of hospitals, it's 800 bob. So definitely in our government hospitals, it should be cheaper. It should maybe be 400 bob. So with that, they're first able to tell us whether it's just blood in urine or there's some other things. A urine analysis is very basic. It's a basic test. It can also be able to tell us whether you have proteins in your urine. Again, that is also not a good sign. So when you see a protein in urine, it can also be able to tell us when you have glucose in urine, which could also be pointing towards whether you're a diabetic. And then there's also something else we call white blood cells or leukocytes, which if you're having a urinary tract infection, they would be elevated. Yeah. And it would at least help us to rule out, does this person have a UTI or not? After which now, you're still, with the same sample, we do what we call a urine culture, microscopy and sensitivity. This will take 3 days though. Because, well, as I like to explain it to my patients, that's when we try to feed the bacteria and try to see what can grow. So that even treating you with the antibiotics, we are really sure that this is the bacteria that could be growing, and if it's fungal, this is the fungi that could be growing. Yeah. Let me again take this opportunity to say just how we should be collecting our urine samples.
All right.
So when we are collecting a urine sample, especially in females, I advise all my clients, all my patients, you first wipe yourself. If you're in your menses especially, so that the blood is not mixed with your urine, you first wipe yourself, and then after which you pee just a little, and then when midstream, you now put in your container and collect the midstream urine. For any diagnosis, it should not be the first urine that you pass out, it should not be the last urine. But in between, you put the container and collect it, and that way you're sure that the sample that you have collected, one, it's clean, meaning it's not infected by other commensal bacteria, and that it's the right sample.
And that is very, very important, especially for people watching. I know that was very educative.
Yeah.
I'm beginning to ask myself if these things are told to you when you're told to go and collect. You know, you just told, well, we need a sample. But now that we have shown you and discussed that, I'm hoping that you would get proper diagnosis. We have questions streaming in. And of course, I can see House Call Medics allow me to pick some of them. Remember, you can also be part of the conversation on our Facebook. We are live at Lookup TV and also on Twitter. Just remember to put the hashtag, of course, The Morning Drift, and we're talking about hematuria, so feel free to ask any questions this morning. House Call Medic saying such an inspiration, not easy being in a male-dominated career. Yeah. Kudos, Dr. Wanjiru, Karimi, looking forward to the conversation. The conversation has begun. House Call Medics, thank you very much. Karen Mthembo saying, good job, doc, very clear. And you would want to talk about then, someone is asking here, is then hematuria a disease or a condition?
Hematuria is a sign or a symptom. It's mostly a sign, because symptom, it's what you're really feeling. Sign is what could be coming. So when I want to explain sign and symptoms, imagine if you have a headache. That's a sign that there's something happening in your body. Yeah? But if, let's say, you have a temperature of 39.8, that's a symptom. It's something that can be recorded. So hematuria is a sign that there could be greater things that are happening in your body. Yeah. Also, one more thing.
Yes.
In patients who gym too much, like you have gone to the gym, you've worked out so much, you have not hydrated, you're breaking down your muscles. And the muscles now cause myoglobinuria, which is muscle cells in your urine, which could also give the same hue as when you're having hematuria. So hematuria is a sign of greater things. When it has other signs or other symptoms, that now will be able to lead us to what exactly we are thinking of.
All right. Yeah. Now, that means do not over-exercise. Is that what you're saying? Sometimes people go to, when you over-exercise, it could also be detrimental to your health?
Yes. And if you're exercising, make sure you hydrate before and after and during your exercise period.
A lot of people have been asking, why do these guys just like carrying around bottled water? Is it some sign of being classy? No, it's actually for their health. So hydrate as much as you can. Of course, more feedback. Allow me. Felix Okoth just saying, good work, Daktari. Of course, thank you very much.
You.
We're continuing to talk about hematuria, and then we would, like you've said, it is a symptom, it is a sign that there could be, something more complicated. The question now would be, therefore, when you're looking at the treatment, you've mentioned the surgery when it happens to be a tumor. Maybe if you could walk us through again in what other treatments are there, depending on the signs and the symptoms, or what we really would be, dealing with at that moment.
Okay.
Yes.
So I will attack all the causes of hematuria individually. If, let's say, you're having an infection, we first rule out the infection, and then we give you an antibiotic based on the culture and sensitivity result. In women, because we have short urethra, we are quite predisposed to having UTIs, but that's not the norm again. When we observe good hygiene, when we hydrate enough, we should be able to reduce your UTI infection rates. Yeah? Another thing which I'd like to talk about is also when you have a urinary tract infection in a child.
Yes.
Again, that is not normal. In girls, especially when they're getting into preschool and they're learning how to potty train, sometimes we do see urinary tract infections in girls who are 3 years old, 4 years old. In boys, however, they are not predisposed to having UTIs commonly. So if your child has a UTI for the first time, maybe we would do basic investigations. It could be just an infection. But if it is repetitive, we have to look out for the anatomy of the child and find ways. There are other conditions. You could be having one kidney, actually. God gave us 2 kidneys, but some people have 1 kidney. There could be some malformation that is happening, an anomaly really, and hematuria could be one of the signs and symptoms that we see. So that is an infection as a cause of hematuria. The other thing which could be causing hematuria, as I've said, is drugs. Yes. So if it is anti-TBs, we will educate the patient that it will just be while you're on anti-TB medication, which is for 6 months, and then we have the other 2 months, or sometimes in some people we do an extra 3 months. But that is what you would expect. It's the same thing as really in patients, again, who are taking iron supplements. They do sometimes notice that their stool color changes to black. So this is just drug-induced causes that could be happening inside you. And then you can also have an irritation, an irritation or irradiation. For the people who work near X-ray machines, that could be a cause of your hematuria, and we would like you to reduce your exposure to the radiation or other chemical substances. Now, the cancers as a cause of the hematuria. If it is a renal cancer, we will first do the basic urine analysis, urine microscopy, culture and sensitivity. If there is no infection, we will do something that is readily available and it's also really affordable, and that is an ultrasound. So we will do a kidney, a ureter, and bladder ultrasound. At least that will be able to pinpoint us to exactly where we are looking at. If needed, we will now also do a CT scan. CT scan is more radiation, slightly more expensive, not available everywhere, but the good thing is that we do have hospitals here and there with CT scan machines, which is a good thing. And we shall now be able to rule out if it is a renal tumor, if it is a bladder tumor, a ureteric tumor. That will be the one thing. So if it is a renal tumor, as I've said, most of them are amendable to surgery.
All right.
God gave us 2 kidneys for a reason. So when the tumor is only affecting 1 kidney, we get to remove it, we take it to the lab for pathology, histopathology. We're able to tell what sort of cancer you have, and then based on the results that we get, we are able now to do chemotherapy, which is giving you medications, yeah?
All right.
If it is bladder tumors, again, that's where a urologist comes in about. We will have first ruled out everything else, and then there's something that we do called cystoscopy. Now, cystoscopy is when we put a camera inside your urethra into the bladder, and we visualize everything that could really be happening. If we do see an abnormal sign on your bladder, we take it out for biopsy, and then we take it to the lab. At least then we should be able to tell. Is it, as I mentioned, schistosoma, which is an infection, which also predisposes someone to getting a bladder cancer, or is it also the cancer itself? Again, the good thing about bladder cancer, it is amendable to surgery up to a certain point, whereby we stage the patient and then we're able to tell, is this person only coming for resections, which we just cut off the tumor cells, or would they need also chemotherapy?
All right. Yeah. And I'm seeing a question here by one Jerry. The second name is a bit difficult, but I think it's a genuine question, and they're asking, can high blood pressure cause hematuria?
No, high blood pressure does not cause hematuria. High blood pressure damages the kidney, which we now call it can either be in the acute phase, so acute kidney injury, or chronic kidney disease.
Okay.
So when you have high blood pressure and then it damages the kidney, then you can get hematuria as a sign. Yeah. Again, those are one of the risk factors that could predispose someone to having either kidney failure or even a cancer. We have diabetes, we have hypertension, smoking and taking alcohol, not in moderation.
Not in moderation.
Yeah.
Okay, that came out clear. And I'm also seeing here, what is a hematuria workup?
Oh, hematuria workup.
Yes.
It's what I had first mentioned. When you do get to someone, they first ask you questions, and then they examine you, the physical examination, and then now we send you to the lab for basic tests like the urine analysis and urinary microscopy, culture and sensitivity to rule out the UTI.
Amazing, quite detailed. I hope that the answers are satisfactory. If they're not, please feel free to still talk to us on our comment section. We're live on Facebook at Lookup TV. And Daktari is very open to these questions. She's actually answering each of them this morning. And I can see here someone is asking about asymptomatic hematuria. And they're asking, how common then is asymptomatic hematuria?
Okay.
Yes.
So asymptomatic hematuria is what I earlier on described, painless hematuria.
Yes.
Because when there is pain, we kind of get relief because we know then it could be a stone, a calculi, or it could be an infection, a urinary tract infection. But then when you have asymptomatic hematuria, you wake up in the morning, you're passing blood in your urine, then that could really be pointing towards maybe you having a cancer or a tumor in any part of your renal system. So that is asymptomatic hematuria. It occurs quite commonly, especially, as I mentioned earlier, in patients who smoke, who work in industries, and patients who are in the rice-growing region in Kenya. Yeah.
All right, ladies and gentlemen, it is quite a discussion today, hematuria, and we're saying there are signs and symptoms that you cannot afford to ignore. And I know a lot of you guys keep asking questions that we have already answered. I think they're coming in much later. But of course, urinating blood after exercise, we have touched on that, where you have said it is when you exercise in excess and do not hydrate. All right, I hope I got that correctly, Daktari.
Yeah.
And of course, we've also touched on hematuria in women, because most people have always had the misconception that this is a male problem. So I like that you have demystified that, and perhaps you want to add more on that knowledge.
Okay. Actually, my problem with hematuria in women is because they always assume that because you have hematuria, you have a urinary tract infection.
Yes, like you said.
Or you are on your menses, which could not be the cause. Yes, bladder cancers are more common in men than in women, but we do not want to lose our mothers, our sisters to this disease, which could be treatable. Yeah.
All right. Daktari, usually on the Healthy Inside Out, where we talk about being healthy inside and outside, most of the questions, especially for women, you've touched on hygiene. You know, you've touched on hygiene, very, very important. I don't know if dieting would come by as well when it comes to, you know, dealing with hematuria in whichever way, dieting, eating right, etc.
So again, when it comes to hematuria, we just need to look at what we are really eating. Remember, I mentioned that also when you have too much protein in you, either because your kidneys are not filtering it well and it's passing through, it could still give you a dark-hued urine sample. Also, when you predispose yourself, let's say like to too much sugar things or really a diet that's just not healthy, you're predisposing yourself to getting hypertension and diabetes, which are all risk factors for kidney illnesses, and therefore it would all just boil down to you getting hematuria. One of the things that I always talk about also is obesity, which is one of the non-communicable diseases. Actually, my paper was also on NCDs and the diseases that they have in urology. So we're looking at things like hypertension. We're looking at things like diabetes. We're looking at things like your cholesterol level. You might find someone, well, who looks slim, but really their cholesterol level is really high. Yeah? So those are all things that you can go to a hospital and ask for. Preferably, fasting levels would be the best, because then you go to a hospital before you've had your breakfast, before 10 a.m., they do the test. Something also that we can simply do is also get a tape measure and measure your abdominal girth. Okay. Just where your umbilicus, people call it mokonyo, is, and be able to tell how exactly you're doing. I know people have glorified tumbo ya wababa.
Kitambi?
Yeah, kitambi ya wababa. You know, you have a big pot belly, and people are saying that that's a sign that you're living a good life, but no, really we need to look at how we're eating, how we exercise, how we're sleeping, you know, just make healthy lifestyle choices. Of course, taking alcohol, I talk about in moderation, because really you should look at how many glasses of wine or bottles of beers that you take, and if you can't just, it's a no-no, because alcohol is a risk factor for so many illnesses, so many tumors. Another thing is smoking.
All right.
And you know, there's the, well, you can be an active smoker if someone uses the cigarette, and then you can also be a passive smoker when you're in close proximity to someone who smokes. Those can all cause side effects in you and can give you, well, disastrous effects in your body. So when we're looking at healthy, whether you're inside or outside, we need to look at what could really be happening. Exercise, hydrate, eat healthy. There are plates which are actually partitioned, more vegetables, less protein, less starches, and we will be heading towards a really healthy nation as Kenya.
And I think she's actually touched on a lot of things, including, you know, someone's asking, then how serious is hematuria? Just seeing what conditions this could be assigned to shows that it is really, really is serious. And like you say, we shouldn't be seeing blood in your urine. That already is serious. And looking at, is hematuria an emergency?
Yes. Yes. Can you imagine you've just gone to the washroom and your urine, which should be pale yellow or clear, just becomes red? I've had patients who had hematuria, even sent me the photos. I kept on telling them, please come to the clinic. This is serious.
All right.
And they kept on, you know, pushing it aside. Really, hematuria is an emergency. Go to your nearest health facility, get examined, do the basic tests, and if it is manageable, they will manage it. If they can't, they will then now refer you to a specialist, like a urologist, who is, well, me. Yeah.
There are actually 3 in Kenya. So when she said they will refer you to us, be sure that you need to get her number after this discussion. And you know, you've touched on if they can manage it, if they can't, and that brings me to the question, even as we're about to wrap up, which you will do for the sake of the viewer who just came in. Can hematuria be cured?
Yes. Yes, yes, and yes. Hematuria is a sign. We can always treat and manage the sign. Once we have found out what exactly the cause is, hematuria is treatable, it's manageable, as long as you get to see the healthcare specialist that you will.
Don't assume that you can get some over-counter.
No,
because that's a behavior people have.
I highly discourage OTC medication.
Yes.
I am pro-see a specialist. We are really, well, not specialists like urologists. We are maybe 50. The rest are men, so we have 3 females.
Yes.
But really, we have clinical officers who are more in the government hospitals, and then we also have medical officers. You'll still find them in government hospitals and also private institutions. And if they cannot manage that, that's when now they will refer you to consultant specialists, and that's when now you come to see us. But really, we do have an open door policy. If you have it, get to be seen, please.
She has actually emphasized on get to be seen more than words. We're coming to the end of the Healthy Inside Out segment, and we're very appreciative of your time. A lot of Kenyans are looking forward to this discussion. Most people wouldn't even know what it is called, but now you know what that condition is called and that it can be cured. But we've also been talked to about, you know, checking what we eat, how much you drink. And one thing, Datari, that you touched on was that you could be a passive smoker. And you do not know about it, so you need to check your environment as well, because there's a way it's going to be touching on your own, you know, health. And I'm going to allow you, in your own words, in your own style, you know, like maybe this is your patient watching from back at home, and you have 3 minutes to maybe talk to them about this particular topic, hematuria. Today, I'm not asking any questions, but what are your parting, you know, words as we close the segment with that camera?
Okay, so I'll try to be really brief. Hematuria, blood in urine. Is it normal? No, it's not. What should you do if you notice that you have blood in urine? Go to your nearest health facility, get to be seen, do a urine analysis. do a urine microscopy, culture and sensitivity. At least then we should be able to know what exactly could be causing your hematuria. And then after that, we should be able to treat it. Please refrain from getting over-the-counter medication. It might look cheap, but at the end of it all, it is expensive. And then finally, when you do get time, you can always follow us. We do have, or give rather, tidbits of information. I try to do that to all my patients to try break down health and to be able to make you, the viewer, you, my patient, to understand health so that you can just be a healthier version of you. So that's my parting shot.
I think I loved every bit of the Healthy Inside Out today. Daktari.
Yeah.
I learned how to pronounce the word as well. Other new words which I know the viewer is acting like, but I know they had, Google on their phones. But remember, like she has said, every other Thursday also, right here on the Morning Drift, we have, amazing doctors who have decided that it's not only the disease-centered, kind of Medicare, it is patient-centered. No wonder this particular show today. And I would say, I'd maybe challenge you to say, do you have health quotes? Because mostly we have a lot of philosophers in other disciplines. Could you people quote anyone in the health sector?
Wow, no. I guess really our medics, the ones who preceded us, were really into books. So do I have one off the top of my mind? No, not right now.
Not right now?
Not right now.
I have to pull a challenge.
Yeah, I've seen that.
But of course, because I have the phone in my hand, I would read one right here that says time and health. Time and health. Everyone says, time is expensive. But did they know that health, just like time, is a precious asset that we don't recognize and appreciate until they have been depleted? And today, me and Dr. Karimi here is saying, don't wait until it's depleted. Take action now.
Yeah.
Well, that's it for the show. This is The Morning Drift. I have loved your presence. I have loved your presence as well back at home on our social media platforms. So to remind you that if you missed this segment, there has been a live stream on Facebook. We are at Workup TV on Facebook, and we are also on Twitter at Workup TV. Remember, the hashtag changes with every other programming. Now we're looking forward to the 1 p.m. news. We have 4 p.m., 7 and 9 p.m. news, and once in a while I would have challenged you to be my co-host.
Oh, really?
But you are not ready for that. So ladies and gentlemen, on YouTube we'll have this uploaded as well, so don't miss it. Once we upload this particular segment on YouTube, please be sure to ask our doctors what you want them to tackle next. So be part of the family on social media and be part of the family live on TV. Connect with us. We are always glad because this is hashtag the all new Workup TV. But for this morning, my name is Anki Doris. But be healthy, stay healthy, and continue watching Workup TV because we are confidently the most accurate hope to the world. Bye-bye.
We value your feedback and welcome your complaints about our programming and operations. Feel free to get in touch with us through 0700 893 542 or send us an email to views@look-up.tv. We can't wait to hear from you.